Hi, everyone. I'm Dr. Ellie McGregor, and I am here with my podcast, I Heal Kids. And I'm the founder of Middle Path Integrative Pediatrics in Asheville, North Carolina. And if you need a pediatrician that's holistic for kiddos ages 0 to 21, then I am your gal in and around Asheville, North Carolina. And if you need functional medicine, ages 2 to 102, then definitely reach out if you're in the states of North Carolina, South Carolina, California, or Florida, and I would be happy to take care of you or your child. And if you don't know what functional medicine is, be sure to check out the podcasts that are linked in the show notes. So I am talking about an interesting topic today. I am talking about something that I never thought I would talk this much about in my life before medical school, but in my career, I talk about it all the time, and it's so important, and that is poop. You heard it, poop. And so I'm going to do actually like a 4-part mini series on poop in childhood and in babies. And so this is actually going to be the first episode in this special mini series all about the childhood poop. So I think that it's really important because of many reasons, but also because, it can give you a real understanding about your baby's and child's gut health and overall health, and probably your own health too. So today we're going to actually talk about like what is normal and understanding what even is normal for a baby or toddler, because you would think that would be like an easy question, but it's really not. And there's like a lot of people that are like, well, how do I even know like if this is okay for my baby? And then in the next couple series, we're going to talk about like constipation, what to do, like what causes it, how to get relief, how to get help, what are the holistic interventions, and what not to do as well. And then I'll move into like diarrhea, because who even knows if their baby's having diarrhea, red flags, all of that. And then last, we're going to talk about the microbiome, because that is a huge topic, and we need to talk about like the gut-brain connection, gut-skin connection, all of the stuff with the microbiome and all that good stuff. So let's get stuck in. So today we're going to focus on what is normal, how poop changes over time, and then when to worry. So let me back up a little bit and talk about like, why does baby poop like even matter? So poop is like basically one of the best non-verbal clues that we have about your baby's digestion. So naturally, parents are going to like obsess about it. I mean, you're not alone. It's like you're looking at it all day long. You're changing a million diapers. So it's going to be on your mind. Babies don't talk, young babies don't talk. So it's like one of their nonverbal cues. So it's always part of my integrative approach to like look at the whole child, including elimination patterns. So, okay, what is normal? Let's start with newborn stages. So first things first, usually your baby's going to have like weird looking black, sticky, almost like tarry poop. And that is called meconium poop. And that is normal in the first few days of life. So if you have like your first baby and they're having like this tarry black poop, that is normal in the first few days. Don't freak out. It's called meconium. And then you'll start to get this like transitional poop. And it's actually called that. It's called transitional stool. And it's greenish brown. It's a little bit looser. And that happens between like days 3 and 7. And there's a little bit of variation with that, just depending on like, if you're breastfeeding or formula feeding, like when this transition happens and like just kind of naturally changing over. And then there's 2 other kinds of poop. So after the transitional poop, you're either going to get the breastfed poop or the formula fed poop. So depending on what you're doing, and you may get a mix if you're kind of like blending both together or you're supplementing. So breastfed poop, it's basically mustard yellow, it's seedy, it kind of smells a little bit sweet. It usually happens several times a day. And then formula fed poop tends to be like more tan, a little bit pastier, like a stronger odor. Usually you'll get 1 or 2 a day. But again, those ranges kind of depend on the baby. And so you'll start to learn like what's normal for your kiddo. And then we're going to transition to like when your kiddo gets older. So as solids are introduced, someone asked me that one time, like, what is a solid? And I actually had not really thought about that before, but that is a really good question. When it's your first baby, like, what do you mean by a solid food? That just means like when you're starting like either purees or baby led weaning. And, if you're interested in that, I definitely have tons of like information on feeding and all of that. And I'm also going to be doing an amazing course for babies 0 to a year old on how to feed them holistically coming soon. So I will link that in the notes as well. And as soon as it's ready, which will be soon, and then we'll link all like the free stuff too. But point being, when you start like your purees and your baby-led weaning or both, the poop is going to be like more formed. It's going to smell yuckier, and the color is going to definitely vary with like what you're feeding them. And one thing to know that I think can be surprising for people is there can be like undigested bits of food, especially like corn or blueberries. Sometimes just like the fibrous shell, it just doesn't digest that well. And it doesn't mean there's anything wrong with your baby's digestive tract. Is just kind of like what happens. So if you're seeing that, don't panic. And around this time, which is usually around 6 months old, the frequency of the poops may kind of decrease, and it may be like one poop every 1 to 2 days or something like that. So sometimes you'll see some change. Okay. So poop colors, like what is okay versus like what are we freaking out about? Okay. So let's start with like totally normal, all typically fine. So if you're seeing yellow poop, green poop, brown poop, generally not an issue at all. Don't need to reach out to anyone. Good to go. If you see red, now this could be blood, but it could be other things too. But you'll want to check in with your pediatrician to make sure. So if you're seeing red, especially in like those first, like months of life, that is a little bit more concerning to me. And that could be blood. And the blood can be anything from like a milk protein allergy to like a little cut, like if the baby has like skin breakdown from like a really bad diaper rash or like a fissure, if they've been constipated, like there can be a lot of reasons for it. But I just want to say, just to calm nerves, like if you're seeing blood, it is like extremely unlikely that it's going to be colon cancer. So a lot of people freak out about that because like in older people, that's what we would worry about, like in your 50s or 60s, if you're seeing blood. But in your newborn, it's not going to be that. I mean, maybe there's like any GI doctors ever see it, let me know, but I have never seen it in 17 years. All right, let's talk about weird colored, like white gray, AKA acolic. So like A-colored poop. If you're seeing that, especially in the beginning of life, like that first month, you do want to let someone know. So it almost looks like, have you guys ever used like that air dry clay, like that color poop? Then that could be like a liver or gallbladder issue. So that is a concern. You do want to talk to your pediatrician and see if they need to do any workup or like ultrasound to make sure everything's working as it should be and all of that. Now, sometimes I do see this color like for kids that are older, maybe they ate something that was kind of that color. And then it went back to normal. I'm less concerned about something like that, but bring it up if you're seeing it, talk it over, and then decide if you need to do anything. Okay. All right. The consistency of poop. So we did the colors: red, could be blood, talk to someone; acolic, gray, talk to someone; and then yellow, green, brown, probably fine. Okay. So now consistency. If you're seeing mucus, so mucus, like on occasion, that's fine. But if you're seeing like every single poop and it's just like so much mucus, that really could be like a gut irritation. So, like in my practice, I had one kiddo who was having this all the time, like just all the time. And their pediatrician at the time was actually just kind of like, no, it's normal, whatever. And luckily, like her mom was pretty worried about it and just wanted a second opinion. So she came and saw me, and that baby actually ended up having a parasite. So if you are seeing like a lot of mucus, like just bring it up and see if it is something that you need to do something about or not. So we'll link also in the show notes and maybe also on social media. I'll just see how it goes, like a baby poop guide that I made for my course, and I'll just include it here too. And then for older kiddos, like if you have a kiddo that's, like 4 years old, I'm going to link also the Bristol stool chart. And that's going to tell you if their poop is normal on a scale, and you're aiming for basically level 4, which, sorry for the reference, but it looks like a soft brown banana. Soft brown banana poop in older kids is normal. If you're seeing like little pebbles or crinkles in the poop where it's almost like lumpy, that's like on the constipated side. And then if you're seeing like a lot of pasty or watery, then that's more on the diarrhea side. And so we'll link the Bristol stool chart as well for the older kiddos. Weird, but totally normal newborn stuff. Okay, let's talk about newborn quirks that seem super scary, but actually really aren't. So cradle cap, baby acne, totally normal. Jaundice and spitting up, probably fine. But when should you be concerned? In my webinar, I walk you through what's normal, what's not normal, and when to call your pediatrician. So join me in this free class because no one should have to Google their way through newborn care. Okay, I'm going to do just like a rapid fire, a couple of like just common questions that people like ask me all the time. We talked about this already, but just to like go through it again. Green poop, normal. Most of the time it is normal, especially if you're having like a fast milk letdown or you're like, doing iron or some other supplement that could be changing the color. Okay. How do I know if my baby has diarrhea? Okay. So that's a good question, right? Because, a lot of times babies poop is kind of like mushy and seedy, and it looks like if you were having that, it would probably be diarrhea. So like, how do you know if your baby is actually having diarrhea versus just normal? And we'll talk more about that in the other series, but just to kind of touch on it, it's basically if it's like water, super watery, explosive, and it's like sudden, there's like a lot of frequency to it. Maybe it's blowing out the diaper, maybe it's going up the booty crack into the hairline, you're getting something kind of dramatic. And especially if you're getting any kind of like watery stool with like discomfort, fussiness, seems like their tummy hurts or they're having a fever, like you definitely want to get that checked out to make sure it's not a diarrheal illness, whether it be viral or I don't know, bacterial or something like that. So definitely just get those checked out. Next question, is my baby constipated, or how do I know if my baby is constipated? Again, we're going to talk more at length in the next one of these series about that. But basically, if they're having like hard pellet like stools, then that's a sign that they're constipated. Now, that is to distinguish from the baby that's learning how to poop. So some babies are like learning how to kind of relax their booties and contract their tummies at the same time, and they kind of turn red and they're trying to push it out and it takes a little bit effort. That is, as long as it's like coming out soft and it's in that kind of baby age, it's usually that they're just kind of working things out. So don't get too stressed about that. And when I say baby age, I mean like 1 month, 2 months, 6 weeks, somewhere in there is usually when I see it. But on the other hand, regardless of like effort, if they are having hard or pellet like stools, or there's stool that has like lumps and bumps on it, that is constipation, whether it's in a baby or a child, regardless of if they're going every day. So like sometimes in like older kids, a lot of times parents will say like, well, my child goes every single day, so there must not be constipated. That is like, so could not be further from the truth, because I have done abdominal x-rays in kiddos just to see what's going on, because they have like big bloated bellies and we're like, oh my goodness, but they're going every day and their belly is just like full of poop, but they're actually just having these little tiny poops that are like pellets or like bumpy, just like little bits, and they're not getting everything out. So why does my baby's poop smell like vinegar? Okay, if you're smelling some like weird, acidic type poop or something like that, definitely talk to your pediatrician about like, is there like some kind of gut imbalance or microbiome imbalance? Sometimes food sensitivities, not always, but that can be a thing too. Okay, when to worry. So like, what are the red flags? You need to call your doctor. You need to like go in, make an appointment, see the ER or something like that. So if you're seeing red in the poop, you want to make sure it's not blood. So first of all, like in older kids, if they are drinking and, you know, I am not a huge fan of like the sports drinks, but I know it happens and like life happens and all of that. So if your baby has like some, Gatorade or Powerade and it has like that orange, red color and they have red in their poop, it is most likely, you guys, that. So you don't need to run into the ER as long as it turns back to normal, after they're eating regular stuff. Beets can do it too. So like those kinds of like red foods, that may not actually be blood. But if you're seeing red, it's not going away despite, like what they're eating, or God forbid, it's like profuse, a spot here or there, you could probably make an appointment with your pediatrician. But if your kiddo is having like profuse blood, like please go to the ER. Okay. No poop in 4 days. So like this depends on the age of the baby. So if your baby is, having a poop every 7 days, but they're comfortable and it's coming out soft, and their belly is not distended, that usually can be okay. But like in an older kid, usually after about 4 days, they're pretty uncomfortable and their belly could be hard. And they might be telling you like, hey, my tummy hurts, all of that. That might not be like a huge worry per se, but you just want to like talk to someone to help them get over their constipation. And we're going to talk about how to do that holistically in the next series or one of the next series. And we'll get into all of that. The last one is, I guess not the last one, but another red flag would be like white or chalky poop. Again, if you're seeing that acolic poop, that could be liver gallbladder. So you really do want to go in quickly, especially if it's a kiddo in that first month of life and you're getting these poops that don't have any color to them or are clay colored. That could be a huge concern. So you do want to just make sure you don't need an ultrasound to make sure that all of that is working as it should. Consistent diarrhea. Okay, so I know in babies this is hard to figure out, but we kind of touched on it earlier and we'll touch on it again. But if you're seeing like full-on blowouts with like frequency and pain and discomfort and like all of this and fever, definitely go in. And then in older kids, especially if you're seeing this after a few days and God forbid they're having weight loss and it's chronic and it's something that's been going on for a while, you definitely want to seek care to make sure there's not like a parasite or a bacteria or a virus. Usually the viral ones will clear, but if it's, persistent for like 7 to 10 days, you definitely want to get that checked. Weight loss, blood in the stool, anything like that. That could be an inflammatory bowel disease. So you just want to make sure, if you're seeing something with like other symptoms, fever, weight loss, diarrhea going on for a while, get help. And then the younger kids, you obviously just want to come in sooner because they can dehydrate faster. So if you're not sure, definitely reach out. And then another one, if your baby or kiddo is uncomfortable or distressed. So if it's like, gosh, they're having something with their belly, but you're not quite sure, regardless of what's going on with them, if the only symptom is just like very fussy, very uncomfortable, very distressed, and you don't know why, it's not like, oh, they've had a cold and, I know that they're uncomfortable from their head cold. It's just like they just seem not right. You want to find out what's going on. You're never going to be overreacting by like coming in for an appointment and getting reassurance. Like no pediatrician is, if they are mad, they need to like go get a spa day or something. But like, I would never be upset if you came in and everything was fine. I would much rather that than you sit at home and worry and, have these thoughts on your mind. Like, could it be this? Could it be that? Like going through all of this stuff. So just, make sure that you are trusting your instincts. You are your baby's expert. If something feels off, it is okay to come and ask questions. And poop, it doesn't have to be like perfect poop. No one has like exactly perfect poop every single day, but you just need to kind of understand like what are the red flags, what's not, and all of that. So if you guys are starting solids soon or you're wondering about like how nutrition connects to poop, my online course, Feeding Your Baby in the First Year Holistically, it dives deeper into all of this. There's a bonus poop section with visual guides as well. And I'll link that in the show notes as soon as it's ready, which will be very, very soon. I just have to edit a couple more videos. And, if you have a new parent who needs help understanding their baby's poop, or maybe, they are a person who with an older kid who's struggling with like constipation or something like that, definitely share this episode and the next episodes with them because I'll just save them a whole headache. Even if someone's like 9 months pregnant, this is a good episode to listen to so they know what to expect like once their baby's born and they're not like, oh my gosh, my baby's having tar coming out of their booty and I don't know if it's okay. You can totally save them that distress by just sharing this episode with them. And be sure to subscribe so that you don't miss the next episode all about constipation. My life is so glamorous, but this is truly so important and it's such a great topic. And we all do need to understand it. And it is true that everybody poops. And I think there's a book on that we can also link in the show notes for those of you who are toilet training, which I think would be a great episode idea. I'll have to do some toilet training ones. All right, guys. Well, Dr. Ellie signing out and I'm wishing you well. And remember, I'm a holistic pediatrician in Asheville, North Carolina, and I serve kids 0 to 21 in and around Asheville for holistic peds, and also do functional medicine for ages 2 to 102 for those of y'all that need a deeper dive into chronic health conditions, and for parents looking to create longevity, vitality, and increase production at work, as well as balance their hormones. So be sure to reach out and hang out for the next pod. Okay, bye guys. Before your baby arrives, have you thought about delayed cord clamping, eye ointment, vitamin K shots, circumcision? Do you even know what you want? Many parents feel blindsided at the hospital or birth center because they didn't even know these were decisions. So I made a webinar that will cover everything that you need to know when the time comes. Don't wait until you're in the delivery room. Please sign up for my free webinar today so that you can feel empowered.